How's it going, everyone? This is Brad Williams with Over 40 Fitness Hacks. I have my new season co-star with me, Dr. Ken Zweig. How's it going, Ken?
It's going great, Brad. Thanks for having me on.
Absolutely. Thank you. So let's move on, Dr. Ken, to behavioral change. We kind of, in your intro, talked about how you kind of got into there, and we'll move on more towards, sleep disorders, but just overall behavioral change on anything. Like what did you kind of implement with your practice? What were you looking for? What kinds of people are you are looking to help?
So everybody,
Everybody. There we
I
go.
mean, nobody is perfect. There's
Yeah.
nobody who's doing absolutely everything they should do. There's always somebody that could improve. And I don't expect anybody to be perfect, but I think everybody should be aware of some of the things that they can do and how they can make things a little easier. There's a lot of tenets to behavior change, and there's so many ways to approach it. So there is no one size fits all, but there is almost always a one size fits you.
Yeah.
So there is something that's going to work, because I have so many people. I guess I would say a couple of things that are really helpful is number one is make sure that whatever it is that you do, whatever you pick to change, and it can be anything. It can, no matter what change you're making, this, whether it's something with work or whether it's something with health or whatever it is, if you're trying to do it, the first thing you need to do is make sure that it's simple and doable. Right? So often I see patients who are like, 20 years ago, I was able to exercise an hour and a half a day. And, now I try to just set it up for an hour and a half. And, I'm just busy. I got kids, everything. So I just don't do anything. And I end up checking my email. Well,
Yeah.
you don't start at an hour and a half. As soon
No,
as you
baby
set the bar
steps.
too high, it's baby steps, right? If you set the bar too high, all you're going to do is make yourself frustrated and feel guilty for doing the same things that you were doing anyways before, which were good for you. And now all you've done is added guilt on top of that. But if you set the bar low and hit it, but set the bar so low that you almost can't not hit it, right?
Yeah.
Even 5 minutes of a walk is 5 minutes more than you did yesterday if you didn't do anything yesterday. Everything counts. And so it's much easier to set the bar low, hit it, give yourself a little pat on the back for doing it, and then do 6 minutes tomorrow or
That's
do
it.
7. And so, just start it low, baby steps, and move it forward as easy as you can. And then the other thing along the same lines is go easy on yourself. We all tend to be so hard on ourselves, and we try something, and then you try it, and you set the bar high, and then you fail, and I'm terrible. I'm worthless. I can't do this. Why even try?
Yeah.
It's such human nature, and it's so easy to be so hard on ourselves. And like I said, you're in LA, it's probably similar there. Inside the Beltway here is just people are just really hard driving because they're so tough on themselves.
Yeah.
And so you try something once and you fail and you don't do it again. I say, if you picked up a new instrument and you did it and you made a wrong note, are you going to give it up forever? I mean, no, of course you wouldn't expect that from yourselves. Everything takes practice. Same thing with behavior change. It takes practice.
Yeah. And what's funny, it's the same advice parents give their children when they're growing up.
When they're doing music, you mean?
We're doing anything, either sports or homework or whatever.
Right.
Like, don't just quit because you had a bad experience. Keep on pumping all that. It's almost like we need to be reminded of that and be treated like kids again as adults. And this is part of behavioral change. Baby steps.
Baby steps, right? Yeah, it's really funny you should say that, because one of the mantras in medical school is that when you're doing pediatrics, that kids are not just small adults. You can't treat them the same as you treat adults. But after I had a kid and realized some of the things we're doing here, I realized that really adults are really mostly just big kids.
Yeah,
we do a lot of the same things, and it's the same stuff, just maybe it looks a little different, but it's very similar.
Yeah, don't overcomplicate it. Dumb it down to the kids for us too.
Exactly. Yeah.
So for behavioral change, kind of the thing I think about is, addictions is kind of part of behavioral change, but a little more extreme for some of the simpler stuff, like, going on a diet or something. There's always a concept of, do the 30-day system, make your behavioral changes within the 30 days, and that kind of locks it in. What's your philosophy on that?
So, I mean, that's great, and if you can, that's wonderful. I mean, they say, I've heard 30 days, I've heard 45 days, I've heard 90 days, everybody's different. Again, there's not going to be a one size fits all. And in a lot of those 30 days things, you just do it for 30 days. Well, if it's hard for you to do for one day, you're not going to do it for 30.
Yeah.
So again, you got to look at it and say, hey, is this reasonable? Is this something that I'm going to do? It shouldn't be suffering. If your diet is, an all celery diet, you're going to do it for about 4 hours and then you're going to quit. So again, make it doable. And then also what you should realize is that if you screw up, if you fail or quote fail, that's okay. Expect it. Go in with the mentality that, hey, you're going to fall off of this at some point. It always happens. You're not going to be able to do it. There's very, very, very few people in the world who are able to be so regimented that they can do the right thing for themselves every day, day in and day out.
Yep.
You're going to have bad days. You're going to have days where that candy bar sounds damn good, or you just don't have the energy to go out for a run. That's okay. It's not a failure. It's expected, so let yourself have that. You need a break. You need a day off. You need to fall off the wagon a little bit, and that's okay as long as you get back up, brush yourself back off, and get back on and start doing it again. And that's the key.
So, Dr. Ken, in your practice, you kind of focus more on the sleep disorders, but is there any other things you keep getting repeatedly coming back to you for behavioral change? Like, is it smoking or dieting, or what are some of the things your clients are coming in with?
Yeah, well, fortunately, most places around the country, smoking is much, much less than it used to be. So that's good. Fortunately, I've
don't have too many of those.
I think I have 2. Yeah, it's amazing. So the smoking has just been really gone by the wayside for the most part, which is nice. And so a couple of things that I see that actually, instead of smoking, I see a lot of drinking.
Oh, wow, yeah.
COVID has really
big time.
Big time, yeah. And it's so prevalent and tough because, unlike smoking where, you become a pariah if you're smoked, everyone wants to stay away from you, you're not allowed at any restaurants or anything. Drinking is such a norm and so socially acceptable. You're almost, an outcast if you don't drink in a lot of situations. Yeah. And so we normalize it so much that people don't think about it as a problem. And they have 3 or 4 drinks a night, and then they're overweight and high blood pressure and they're depressed and can't sleep. And they think, oh, it's not the drinking. That's how I de-stress at the end of the day. It has nothing to do with the alcohol. Well, no, actually, it's almost directly related to the alcohol.
Yeah.
And so that's a tough one that I see very often, and a lot more so recently. And some people recognize it, but a lot of people don't see it and don't see the connection, and are hard to motivate in that direction. If they don't want to do it, they're not going to change. So you have to just keep on, just give them a little nudge and saying, hey, this is what I think it is. This is what I think it is, until they come around and finally are like, yeah, you're right. Okay, I'm willing to give this a try and get off of this. But
yeah,
that's a big one, is alcohol, that people don't think about.
So besides working on the behavior for whatever alcohol or sleep or whatever they're coming for you, as being in internal medicine, are you do you see that there's certain drugs that help them with those progresses for each one? I know for alcohol there's stuff out there that can help them the desire not to drink, and then other drugs you actually take it, and if you do take a sip, it's almost an involuntary response to chuck it out.
Right.
So do you use a lot of that stuff, or is it more of just working the program and steps? And
it really depends on the patient. I say there's a pill for every occasion.
So that's the thing. Okay.
So if you want, I can prescribe something for almost every single condition that you can think of, because the drug companies, if there's money to be made, they'll be willing to make a pill for it. I try to avoid that. I don't want to prescribe medications for people. They don't want to be on them, and most of the time, and I don't want to give them, and there's side effects and things and costs associated with it. So if you're in a situation, with everything in medicine, you want the benefits to outweigh the risks. So if the benefit of the drug is far greater than the risk of the drug, then it's certainly worth at least talking about. And if the patient's willing to consider it and willing to take it, because best drug in the world doesn't do any good if you don't take it.
Yeah.
So if they're willing to take it, then yeah, okay, then we can talk about what the benefits are, what the risks are, and see how they feel about it. But except in really significant cases of alcoholism or other things, or excessive obesity, I try to avoid the medications, at least at first. If we've failed repeatedly behavior change over and over again, and they are frustrated and want to try something, then yeah, medication certainly can play a role. But there's almost no medication in any condition that will fix a problem.
Yeah.
They're just another tool that can, again, nudge you in the right direction and help you go where you want to go. But you really, at least for things like obesity and exercise, heart disease, you have to do it in conjunction with diet and the exercise.
Yeah.
You can't do it instead of those. So.
Yeah. Well, I think too, I just keep hearing it and know it to be true that, with behavioral change, just step number one is you have to want, to stop or change whatever you're doing. If you don't even have that and you're being forced into it, oh my God, it's just going to be a horrible roller coaster.
And you also have to believe you can do it too.
Yes.
Not only you have to want to do it.
Want and believe.
And believe that you can do it, and believe that change is going to make the result that you're looking for. So those things have to be in there from the very beginning before
or there's no chance.
No chance, right?
Yep. I agree. So Dr. Ken, how does my audience get a hold of you? More for the behavioral change and sleep disorder. Sure. Is there a website, or do you have anything they can download, or?
Sure. Yeah. So the best place to go is to my practice's website on NVA. So that's N as in Nancy, V as in Victor, A as in Apple, familypractice.com. Okay. So it's all one word. And on there, if you go to the media section, I have a blog there. We have a lot of videos, something called a town hall that we do about once a month on all kinds of different subjects. So we try to keep our patients as informed as we possibly can.
Okay. And then some website if they want to book a session with you, or?
Sure. Yeah. That's the best way to find us. Yeah.
Okay, cool. And my audience always knows that I, throw all that in the podcast details so they can just click the link instead of trying to, remember that, type it in.
That's great. Good. That's
so
much easier.
Yeah. But yeah, no, sleep is very huge in my world too. And then it's the most looked over aspect of it. Everyone wants to do the bodybuilding, working out, which, nutrition's even more important than that. And then on top of that, sleep, and no one's doing anything with that. So it's great that there's people out there like you that are putting more light on this and get us as healthy as we can be.
That's the goal. That's my idea. So,
that's it.
That's great. Yeah, I'm glad you're doing it too by bringing it to light with podcasts, making sure that everybody, just gets the information first. That's the first stuff is education.
Absolutely. Well, thanks, Dr. Ken. I really appreciate you being on the show, and we'll check back in with you probably sooner than later.
All right. Sounds great. Thanks so much. I really appreciate it.
Awesome.